I'm David Lombardo, and you're listening to WCNY's The Capitol Press Room. A move by the Hochul administration to reduce training hours required by certified nurse aides in New York to the minimum standards set at the federal level in order to more quickly replenish the state's depleted healthcare ranks is drawing pushback from some healthcare stakeholders, like the Long-Term Care Community Coalition, which argues this lower threshold could reduce the quality of care that CNAs provide. For more on those concerns of the coalition, which works to improve the quality of life for residents of nursing homes and assisted living facilities, we're joined by their executive director, Richard Mollot. Thanks for making the time, Richard.
David, thanks so much for having me. I appreciate it.
Well, I guess for starters, can you elaborate on what certified nurse aides or CNAs are actually responsible for in long-term care facilities like nursing homes or assisted living facilities?
Sure. And well, actually, it's we're really talking about nursing homes here because assisted living have different types of aides, generally not at the level of CNAs at all. But in nursing homes, essentially, really the only people who provide resident care are registered nurses, licensed practical nurses, and CNAs. And it's the CNAs, the certified nurse aides, that provide 90% of the beds, what we call bedside care, helping residents with dining, helping residents with, ambulating, helping residents go to the bathroom and to bathe, and for all of their other care needs. That really falls for, again, 90% of it really goes to the CNA. So they are absolutely essential.
And this move, in terms of changing the training hours required, is done according to the state to boost the number of CNAs that are in New York, arguing that this current threshold is a deterrent to people. Before we get into the merits of that argument, what about this idea that we don't have enough CNAs? Is that your understanding?
No,
Okay.
it's not. I've been hearing this for my entire career. When I read congressional testimony from the 80s and the 90s, it's the same thing. The nursing home industry lobbyists say, "Oh, we'd love to hire more people. We just give us more money, or they're not the people out there." And that's just not true. The real problem is that nursing homes have enormously high turnover rates. Even through the COVID pandemic, there were some strains on staffing, of course, but for the most part, they've been pretty steady throughout the course of my career. And I should say that in the time that we've been tracking this for close to 24 years since 2017, with some really good payroll-based auditable data on staffing, nursing homes in New York have been in the bottom quintile, the bottom 20% in the whole country in terms of their staffing. Again, the issue being that too many providers make this position untenable to stay in. So we have an enormously high turnover rate.
An editorial by Newsday noted that prior to, I think, 2023, New York was at the federal minimum standard of requiring 75 hours of in-classroom training. And you're giving me a look. Are they wrong? What was
Yeah,
the
that's
threshold?
incorrect.
Okay, so
There was some relaxation of the standards during the COVID pandemic, but all the aides who, post COVID, they had to meet with the current standards for nurse aid training. So, but New York actually, as I've read, and I didn't include this in our comments to the Department of Health on this issue, but as I've read, New York actually had a standard even before there was a federal standard. I just couldn't find a citation for it to be honest, to feel comfortable to include it in our comments. But that's what I came across from the late 80s, early 90s, was that New York has had a standard for a long time. And again, the majority of states now have a higher than the federal minimum standard, and New York has been among them for many, many decades.
well, you've argued that lowering the threshold from 100 hours to 75 hours is not backed by any sort of evidence-based rationale. But is there any reason to believe that 100 hours is some sort of gold standard when it comes to training? Because it seems like just a nice round number.
Well, it's about, obviously it's about a third higher than the federal standards. The work that we've done in the past, working actually with providers and with unions, identified a baseline training of about 150 hours. And there were two major federal studies, National Academy study in, I think, 2022, and a Institute of Medicine study in 2008, both of which recommended that the federal minimum be increased to 120 hours. Resident needs have increased. Residents now have higher needs than they did 40 years ago when the nursing home reform law was first implemented. So it's really getting at those, well, excuse me, it's ensuring that CNA staff are prepared to adequately meet the needs of those residents with higher needs.
Well, what do you envision potentially happening as a result of only requiring that federal minimum of 75 hours? Because as you pointed out, CNAs are not necessarily responsible for the most high level of medical services. They are providing assistance for eating and dressing and moving around, say, your nursing home space. So is there reason to think that they can't do that with 75 hours of training?
Yes, well, as I said, when we worked with other stakeholders on developing a training program here in New York many years ago, that training program was really about 150 hours. I know that many of the union trainings are well over 100 hours, but essentially the point is that think about it. CNAs need to know how to help a resident with dining. Dining is actually a very, very complex issue. Someone has dementia, they may be liable to not swallow or have swallowing issues. Other people with different kinds of medical issues also could have swallowing issues. Sometimes they pack their food. Seeing when someone who you're providing care for, if they have other issues and how to identify them, other clinical issues, because they're the people who are by the bed. RNs are generally not really by the bedside, helping residents directly. LPNs do some of that, but it's really the CNA. So, who are the eyes and the ears of the facility in terms of what is going on with the resident, in terms of their abilities and responding to those abilities? That all goes to the CNA. So, we have dementia care training, we have dignity training, we have abuse training, we have feeding training, we have toileting training. The list goes on and on and on and on. And those things require more than a half-hour session.
If the state ultimately moves forward with reducing this training requirement, what sort of transparency and accountability measures do you think should be put in place to gauge the effectiveness, to assess, well, what is the experience of someone with 75 hours of experience versus 100 hours of experience? And how does maybe the pipeline of new CNAs now compare to in the years past when they were facing 100 hours of training? I mean, is that something you'd like to see if the state does decide to go ahead with this?
That's a really interesting question. I mean, the problem we have and have had for forever, frankly, especially in New York, is that there's just not enough staff. So there's not enough appropriate care being provided to residents as we speak right now. And that's unfortunately true. The large majority of our nursing homes here in New York do not have the expected staffing necessary to meet the needs of their residents. We track those data and publish them every quarter on our website. So how we'll be able to track the difference here? I mean, I'm of course concerned that we're going to see a declining even further of quality of care, a declining of treatment with dignity, a declining of identification of abuse, sexual abuse, physical abuse, emotional abuse, etc. And I think it's going to, frankly, exacerbate the worker issue because it'll help nursing homes to just grab in people off the street with, it'll make it much easier. Yes. I mean, and that's why the industry is pushing this, but it won't enable those people to really be equipped for the job. And how will we know that? I guess by things, potentially getting worse in terms of turnover, which we can track, and things getting worse in terms of resident quality, which we can track as well.
Well, unfortunately, that's all the time we have for this conversation. We've been speaking with Richard Mollot. He is the executive director of the state's long-term care community coalition. Richard, thank you so much for joining us. Really appreciate it.
David, thanks so much. I appreciate it.
Support for the Capitol Press Room is provided by New York State United Teachers, a statewide union of nearly 700,000 professionals in education and healthcare.